Welcome back to Talk 1260 KTRC. You're listening to the Humanity Behind the Vanity.
We're here with our second segment of patient emails again. We get so many and we love them. And
Thank
so,
you.
yes, this is our one segment a month where we address them. Okay, so the first one is from a woman named Ruthie, and it's about breast implants. I have saline breast implants that are 9 years old. They are starting to look as if they are gradually deflating, and of course I have the ripple effect. I need to get my implants worked on soon. I need to give you the date. And I'm also curious about recovery time after it. Will it be as, quote, brutal, unquote, as when I first went under the knife? And I also need price information. Okay, please contact me. Thank you, Ruthie.
That's a great question.
Yeah.
Rippling is a pretty common side effect. Well, not side effect. It happens after breast implantation. It can happen from loss of saline if there is saline in the implant. It can happen if the implant is overfilled. If you imagine a balloon full of saline, and you just a balloon, and you fill it too much, it starts to elongate and get rippling in it. So the manufacturer who gives us the implants gives us a specific range within which to stay, and that's important to do. Despite that, you can still get rippling. Another cause of rippling is somebody who's just very thin, who just doesn't have a whole lot of soft tissue, and they may have an implant that's a little too big for them, or too big for that soft tissue envelope, and so you start to see the rippling. So what do you do? It's not easy. If the patient has saline implants, the thought is that putting in silicone implants is better because there is less rippling with silicone, number one. If the implant is above the muscle, then that's easy. You can put it below the muscle. It's called changing the pocket. And another one is if the implant is large, you may have to downsize. You may have to go down a little bit, and often that leads to a necessity to reduce the envelope, the skin envelope, which leads to bigger scar. Right, so you may need a breast lift, which is a larger incision.
Yeah.
For a while I was experimenting with something called alloderm. It wasn't really an experiment because it's a device that has been used for years. It's extremely expensive, and it's used for reconstructive surgery. And what it is, it's an artificial dermis. It's the part of the skin that's not the very top layer of skin. And we use it for example, in breast reconstruction for adding soft tissue. It's used in like shoulder repairs and some Achilles tendon repairs. It's basically the skin of a cadaver that has had all the cells removed from it, so it's not dangerous, but it still has the scaffolding. And so the company approached me and said, you know, we might be interested in seeing if there's a market for this in the cosmetic field. And sure enough, when you put this alloderm, a sheet of this alloderm, over a rippled implant, it looks fantastic.
Really?
It looks fantastic. The problem is it's extremely expensive, and I have not found cosmetic patients who want to spend that extra. It's thousands of dollars.
Oh, well.
Yeah, I mean like $2,000 or $3,000 more. And yes, there were some who were willing to do it. It's really a fantastic thing, but it's not ready for prime time.
Right, they need to get bigger so they can reduce their prices.
So yeah, just in to summarize how to treat rippling, switch to silicone implant if that's an option. Go under the muscle if that's an option. Go smaller in size if that's an option. The second question that you asked was, is this going to be as brutal? It's almost always not. It's always almost not as bad to go back the second time because the incision's already there. You already know what to expect.
The pocket's already there.
The pocket's already there. Now, if there is a significant problem and going back the second time requires a significant reconstruction or revision,
scar tissue.
then yes, it can be pretty bad. Just yesterday I took ruptured silicone implants out of a lady. The first one was placed, I think, in the late 60s, early 70s, and this is a kind of silicone I'd never seen. It was milky white.
Oh.
But she had so much scar tissue in there, and she had a big nodule on her muscle. You know, and so excising that was difficult.
That's reconstruction.
So that is a case where the second time is harder.
But those are fewer and far between.
Those are fewer and far between. If somebody needs a revision for a ripple or an implant malposition or a size change, it's usually not a big deal.
Here's a question I always wonder. How does the saline evaporate from the pocket? I mean, the shell?
How does silicone, you mean?
Saline.
Usually there's a small rupture, like
Oh.
a pinhole leak, and it's, when it doesn't just deflate totally,
Right.
when it just slowly deflates, that means there's a problem with the shell, like a manufacturing defect, and it's just leaking out through a tiny, tiny pore.
Do the manufacturers replace those?
Sometimes. Now they do. Now they have a lifetime warranty.
Oh, good.
On some of the older models, they never had that in place, so they don't do it.
Oh, well, that's good to know.
Yeah.
Okay, good. All right, so thank you again, Ruthie.
Yes.
Great questions. You ready?
Yes.
Okay. The next question is from a man named John. Dear doctor, I'm 65 years old. I weigh 175 pounds. I'm 5'9" tall. Unfortunately, I'm not able to lose the fat around my waist as I once was. It's causing other problems such as lower back pain. And ideally, a few years ago, my normal weight was 163 or less, maybe even 160. These extra pounds are now literally a burden on my health.
Okay.
What to do, John? What to do?
This is a common question, is can fat excision help these kinds of symptoms, such as lower back pain or other somatic symptoms? And the answer is really no, because there are no studies that link removal of fat from the midriff to the resolution of lower back pain. It may be a part of it, but lower back pain and generally not feeling well is caused by so many different things. Perhaps one of them is having a beer belly or a large gut. But in fact, if you do a study that shows before and after sucking out or cutting out the fat, it does not correlate. And that is why insurance companies do not reimburse for tummy tucks and liposuction.
Those insurance companies will find any way not to pay us.
I mean,
love it.
that's true, but I also,
I resent it.
yeah, everybody has issues with insurance companies, but you
Yeah.
also have to be fair. If we didn't have insurance companies, we'd be
It should
really
be-
in terrible shape.
Okay, I'm not going to get into the topic. but-
Okay.
All right. Many rights.
There is a case if you have a very, very large overhanging skin called a pannus.
Pannus, right.
And that is usually after massive weight loss, and that causes rashes under the skin.
It can
Then they
impede
will
your
cover
walking.
that.
I mean,
Yes,
it's
they will
serious.
cover that. But at the range that John is talking about, 170, being 15 pounds
Right.
overweight, that's
And then we'll cut it, John.
it's not a health issue. So I'm happy to see somebody like this, and I can suck out the fat and I can cut it out, but I can't promise that it's going to alleviate the back pain.
physical pain, right.
All right, actually, we're running out of
Yeah, we're running out of time.
So,
Jeez.
we're going to get to
We'll do
more
this
questions
again.
later. You've been listening to Talk 1260 KTRC, the Humanity Behind the Vanity. This is Dr. Dan Ronel. I want to thank our generous supporters, Suniva Medical, the makers of Artifil, and iFlow, the makers of the Pain Buster.
The On Cue Pain Buster.
That's a big 10-4.
And thank all of you.
Everything was good.
I'm sorry. It's fine. I'm just going to redo mine, Gino.
And thank all of you.
Gino's hungry.
Yeah,
Thank-
come in.
He's hangry. He's hangry is what Larry used to
On
say.
cue, Pain
He's
Buster.
hangry. And thanks to all of you for your continued support and listening. We really appreciate all your emails, all your compliments, all your comments, and we look forward to doing this again next week. Talk to you then.
There we go.